This is quite honestly the most trying time that I have ever experienced in 30 years of being a surgeon. This is worse than spending time in Iraq 2 years ago. This is worse than any major catastrophe I've participated in stateside. The unknown of this disease is just honestly terrifying. People are either minimally sick or they're on a ventilator for 2 weeks. And for what we are seeing here locally, there's little in between those two extremes.
But as far as the numbers, really the number of people we have seen is not a lot right now, right this minute. But the one thing which is very striking is they're very, very sick. You know, we had 5 patients, and really out of 5 of them, 4 of them were on life support. So that can show you how sick they were.
Symptoms are various, but the most common are cough and fever. Some patients are having sneezing and upper respiratory type infections symptoms. Headache is a fairly common symptom, and actually nausea can be a symptom too.
I've had the luxury of doing this for about 3 decades now, and I have friends that do this literally all over the country and in Britain and Australia. And we've done pretty much the exact same thing that everyone else has done, but we've had the luxury of being able to do it before we get overwhelmed. We've locked down the hospital. We're not having people traipsing in and out of here all the time. It's terrible for patients that are going through horrible things alone, but it's so much safer for everyone.
The very scary thing about this virus is that there are asymptomatic carriers out in the community that are potentially exposing patients and not knowing it. It's just how contagious this is compared to other types of viruses that we've encountered in the past.
We all need to consider ourselves as if we are COVID positive, that we have the virus already. So we have to stay away from other people as much as possible. So really the virus doesn't get from one person to another.
This is a real thing. This is a real scary disease for us, in that the patient that's positive, that's not intubated, is highly contagious to the healthcare personnel, and we're having to take extreme precautions to try to avoid being sick ourselves.
So staying away from other people as much as possible and hand washing really is the most important thing we can do.
In 1918-ish, the Spanish flu wiped out a huge proportion of the world's population. We have no better treatment for COVID-19 than they did at the turn of the 20th century for the Spanish flu. The only thing that we have going for us is the ability to spread information quickly. And that information is stay away. Don't be out needlessly. Don't go out in groups. Send one person to the grocery store. Keep your family safe. That's our message.